Zackie Achmat is receiving the James and Sarah Fries Prize for Improving Health Award for his groundbreaking work in increasing access to life-saving therapies for people living with HIV/AIDS in South Africa and other low and middle-income countries. His efforts have led to millions of lives saved and substantial increases in life expectancy.
I myself learned that I had HIV in 1990. I was given 6 months to live and I went to bed, and I personally just spent all the time watching as many movies as I can before I died and reading as many books as possible before I died. 6 months later, all I found is I'd become very chubby. So I got out of bed and I had to start my life all over again.
Don't speak to us of a partnership of care and compassion. Talk to us about a partnership that will save lives.
On the 10th of December 1998, which was International Human Rights Day, we formed the Treatment Action Campaign. When TAC was formed in 1998, our demands were, first and foremost, that pregnant women should get access to antiretrovirals to prevent mother-to-child transmission of HIV. Our second demand was to ensure that opportunistic infections were treated and that medicines would be made available. The third demand was that drug companies should bring down the prices of antiretroviral therapy. And our last demand was a public healthcare system that covers everyone in South Africa on an equal basis. That was the start. The main job that we did was to ensure that we became educated. And that started at community level, where people living with HIV suddenly found that they had agency. Most importantly, we all started wearing an HIV positive t-shirt, which I actually designed. And it became iconic. We used it to create an openness about HIV and encourage everyone to wear it so that we could destigmatize the illness. A critical factor in all the work we did was international solidarity. So globally, we built a movement in communities, in informal settlements, at provincial level, at national level, and across almost every continent. The best moment of my life personally in relation to HIV was in July 2002, President Mandela visited me at home. And I asked him not simply to meet with me, but to meet with Treatment Action Campaign leaders, which he did. When Mandela wore the HIV positive t-shirt, I knew that it was a matter of months before I would start treatment.
Zackie exemplifies the true intention of the James and Sarah Fries Prize for Improving Health, and that is doing the most good for the most people. Congratulations, Zackie.